Our presenter, Iman, is a highly experienced professional specializing in scientific and regulatory affairs within the medical device and IVD industry. Just a few housekeeping items. Please remain muted with your camera off. Arazy Group members will be the only ones able to ask questions during the session. If you do have any questions, please note them down. You'll receive a follow-up email after the session, so you'll be able to ask any questions you may have and get answers directly from Iman. We will be recording the meeting, but unfortunately will not be able to distribute the recording. I think that's all from me, so over to Iman. Thank you for being here once again.
Thank you, Isabel. Hello, everybody, and welcome to our monthly regulatory update meeting for February 2024. And the country covered today in our meeting will be China, Malaysia, Taiwan, Ecuador, Sri Lanka, Hong Kong, and Singapore. In Taiwan, the update revolves around medical device regulation updates. On November 27, 2023, the Taiwan Food and Drug Administration announced amendment to certain provisions outlined in the regulation governing the issuance of medical device licenses, listing, and annual declaration. The amendments specifically pertain to Article 3, 7, 13, 14, 20, 21, 26, and the Appendix 1 of Article 5 that was updated, Appendices 2, 3 of Article 6. Following a comprehensive analysis of the modification in these articles, I have highlighted here the most significant changes. So to begin, as of the aforementioned date, the QSD number, previously not obligatory on product approval, is now a requirement for both product registration procedure and license amendment. This change is stipulated in the amended version of Article 3 and Article 13. And it is important to note that device products approved before the implementation of this new regulation are exempt from the QSD number requirement. Furthermore, under the revised regulation, in instances where documents are missing or other deficiencies are identified during the preliminary review, applicants can now have a 1-month period to address such issue. This marks a notable departure from the previous provision, which granted applicant a 4-month, so there is a reduction of time. 4-month. This amendment could be found in detail in Article 7 of this update. The second country in our today's meeting is Sri Lanka. And here we will review updates concerning medical device registration and license amendment. Let's start with the first update. So regarding medical device registration, on January 18, 2024, the National Medicine Regulatory Authority, NMRA, issued important announcement directed toward all stakeholders, including manufacturers, importers, distributors, healthcare providers, and end users of medical devices. So the communication aims to notify all these stakeholders and updates all concerned parties about significant changes pertaining to medical devices. Specifically, it stipulated that any instrument, apparatus, appliances, software materials, or other article used singly or in combination, including the necessary software for proper application intended for laser procedure, microneedling, thread lifting, cavitation, electromuscular stimulation, high-intensity ultrasound tightening, and radio frequency technology for skin tightening. All this must be registered under the category of medical devices. Now it is stated clearly in this announcement. Now for the license amendment update, on June 30, 2023, the NMRA issued a crucial notice addressed to all importers of medical devices. The notice stipulated that going forward, importers are required to include 10 models with minor changes in each registration certificate. This emphasizes that these changes should not compromise the quality, safety, and effectiveness, of course, or intended use of the medical device. This directive aims to enhance the registration process by accommodating multiple models under a single certificate, while ensuring continued adherence to safety and efficacy standards. Now, in Ecuador, we will review two important points. The first one regarding the fees, the update of the fees list for 2024, and we have done here an in-depth analysis of the updated medical device regulation that we will present point by point regarding the regulatory registration of medical device in Ecuador. So the first point regarding the fees for 2024, as you can see here, this is concerning registration, amendment, renewal. There will be no changes. After careful analysis of the updated list, we can see that for the medical devices, there will be no changes in the fee for 2024. So the fees remain as outlined in this table for new product registration, license amendment, and renewal. Now, we will review most important changes in the medical device regulation update, as I said, in a comparative table between the previous and the current regulation. So the new regulation was issued in November 2023 through this resolution ERCSADE 2023-033AK RG, introducing a partial amendment to the technical sanitary regulation, as it's called in Ecuador. So the first update in Article 5 is regarding the simplified registration procedure. The evaluation period by the competent authority was used to be 30 days, starting from the submission of the request by the user. Now it is reduced to 15 days. So now there is 15 days for the evaluation period for a simplified registration procedure. The second update details in Article 6, again related to simplified registration. So in the previous regulation, the applicant was required to submit, this is very important point. The applicant was required to submit from the beginning all the documents required in a normal registration, even if it's a simplified registration. And the authority will review only the following 5 documents: letter from the applicant opting for the simplified procedure, health registration or its equivalent granted by other authority applicable for the simplified process, authorization from the product owner authorizing the applicant to obtain health registration in Ecuador, user manual, and drafts of labels. So this is in the previous regulation. And again, in the same, in the previous regulation, all the other submitted documents are not subject to evaluation for obtaining the health registration. So we present all the required documents in a normal registration. Only these 5 documents will be reviewed, and all the other documents will not be reviewed. However, it will be inspected. It was used to be inspected and assessed in the subsequent health control and surveillance product. Now, what is the difference? Now, with the new update, only these 5 documents plus CFS must be submitted in the application of simplified process from the beginning. And after the approval of the simplified registration application, The other documents that are normally requested in a normal application must be submitted to the competent authority through modification request within 30 days from the approval. Otherwise, the license could be cancelled. So this is, be careful with this new change for applicants interested in a simplified process in Ecuador. Now, the third update in Article 14 regarding the technical document and legal document. So in the previous regulation for technical document, it was required to submit in either Spanish and or English. Can see in the left part of the table. This requirement was not changed. However, it was required to in the previous registration to sign the technical document by a responsible person one by one, or to accompany them by a letter listing the attached document, technical document duly signed by the technical responsible person in Ecuador. Now, in the new amendment, the listing it is not an option to anymore to sign the technical document one by one. It is now required to list all the technical document in a letter and sign them electronically by the technical person in Ecuador. And the electrical signature must allow for validation or authenticity. So this was for the technical document, slight change. For the legal document in the previous regulation, the presentation was required in official translation into Spanish only. Now with the new amendment, more flexible, the presentation is either accepted in Spanish or English. However, should be apostilled or legalized as applicable, with exception for electronically used issued document, provided their authenticity can be verified on the issuing entity website. And in cases where the legal document for the imported product are in another language other than Spanish or English, here the translation must be conducted by a certified translator and or authorized center, ensuring consistency with the original document. So this was an important update regarding the technical and legal document language. Okay. So now for in the article 15 regarding the applicability of several requirements. So here, yeah, we will see that in the article 15 there is several requirements that we'll see one by one. The first one concerning the requirement of a description of the functional component, part and structure of medical device. It is now, as we can see here highlighted in blue, the difference. It is now required for all classes of DMNI. You can find here all this like explanation for all this type of medical devices. So it is now required for all classes of DMNI and DMI, while previously was only required for class 2, 3, and 4. In addition, it is now required for DMDIV, but only the ones considered as electromedical equipment or laboratory equipment. In the previous regulation, it was not required at all for DMDIV, as you can see here and now. In the same article 15, concerning now the information only for combined medical devices for human use, including the generic name or international non-proprietary name of the active ingredient and quantitative formula with active ingredient and excipient of the medication. Okay, here, since it is a combined medical device, we are talking about medication excipient. It is not anymore required for DMDIV. Now, in the same article, the new regulation narrowed down the requirement for providing a description of the primary and secondary packaging, along with technical specification. This requirement specifically applies now to active therapeutic medical devices and in vitro diagnostic devices for human use that are not electromedical or laboratory equipment of DMDIV and DMA of Class 3 and Class 4. For the requirement of stability study, it is now required for all classes of all type of active therapeutic medical devices and in vitro diagnostic devices for human use that are not electromedical or laboratory equipment. Of course, these requirements concern medical devices that require an expiration date, since we are talking about stability. And I think this one is the last one for the Article 15. So in the current update, biofunctionality study are not anymore required for DMA and DMDIV. Clinical study specify that is applicable for DMDIV, but only for class 3 and 4. And studies applicable to IVD are not anymore required for DMI and DMA. We have one more. So this is a concern certificate of compliance by the manufacturer with the standard of quality or quality management system for medical devices for human use that they produce. The certification may include one of the following. As you can see, GMP, certificates of compliance with ISO 13485. And here, it is now required for all medical device and IVD of classes, for all the type of medical devices and all classes, where in the previous regulation there was some restriction for class 3 or class 3 and 4. Okay, that was all regarding the regulatory updates in the new resolution for in Ecuador. Now we will review some changes in Malaysia concerning the grouping of medical device. So this was published on January 2024. This is the second version of this guidance. And it was updated to provide guidance to determine appropriate way to group medical device for the registration application. So in this version, it is stated that general medical devices can be grouped into one of the following 4 categories: single, system, family, and set. And 2 previous grouping were removed, the IVD test kit and IVD cluster. However, 2 special grouping were added. Special grouping for IVF medical devices and specific grouping for hearing aids. So this is the update in the grouping for medical device, and of course more details regarding the new definition or more details regarding all these grouping criteria can be found in the guidance. But should bear in mind that it is officially now just 4 classes, 4 kind of grouping, not 6 as previously. So in China, the update is regarding the issuance guidances for registration of some specific products. Here, this is just to inform that on January 3rd, the CMDA made a significant announcement announcing the release of 12 registration review guidance. This guidance, as we can see here, sorry. The research registration include a research registration review guideline for the main raw material or IVD, and guideline for writing instructions for IVD, plus 10 other guidances for the registration of hepatitis C virus antibody detection reagent, Zika virus nucleic acid detection reagent, Aspergillus nucleic acid detection reagent, blood glucose monitoring system for self-testing, quantitative detection reagent for tumor markers, influenza virus nucleic acid detection reagent, influenza virus antigen detection reagent, pathogen specific M-type immunoglobulin qualitative detection reagent, and finally hepatitis B virus DNA detection reagent. So these are 12 guidance. Some of them are new, some others are updates, and the other two regarding the research, review, and writing instruction. Important guidance in China. So in Hong Kong, we review three updates: artificial intelligence, medical devices, software, medical devices, and cybersecurity, and some changes of listed medical devices. Regarding the artificial intelligence medical devices, AIMD, on January 3rd of this year, Hong Kong Medical Device Division, NDD, issued the technical reference document TR008, Artificial Intelligence Medical Devices, that take immediate effect. This document aims to provide references on the listing requirement for this kind of medical devices from a technical perspective. So basically, in this document, you can find the requirement for listing of this AIMD. We can find the information that shall be properly recorded, maintained, and made available upon request by the NDD. Can find the international standards or equivalent to follow. The requirement in case of AIMD with continuous learning capability known as CLC, and post-market monitoring requirement. And previously in December 29, 2023, NDD issued the technical reference document now for software, medical devices, and cybersecurity known as TR007 that takes also immediate effect. This document aims to provide clear definition about the SIMD when software is embedded in an MD, and SAMD when standalone software is considered to be an MD. So this document also provides guidance for its listing, including classification and cybersecurity requirement under MDACS. You can find all this detail in this technical document. Important document. And the third point in Hong Kong. So here where we will talk about the changes of listed medical devices. Yeah. On November 2023, MDD issued a guidance note for changes of listed devices known as GN10, and that took effect on January 1st, 2024. So here, the local responsible person known as LRP has the responsibility to timely inform the MDD of any change to the listed medical device. And the LRP shall report any major change of a listed medical device by submitting a change application as soon as possible and should be at least 12 weeks prior to any planned implementation. Okay. And the MDD may require the LRP to submit, when necessary, any information and document as the basis for supporting the changes, of course, or certification licenses related to the listed medical device then should remain valid and be made available to MDD upon request. And for minor changes, the LRP shall notify MDD, but here is within 24 weeks from the time the LRP is aware of the change. That was all for Hong Kong. So the last country for today is Singapore. And here we review new fees for 2024. Here I have highlighted the new fees in green. You can see here for all classes, including devices incorporation medicinal product for class D. This concern application submitted on or after 1st July 2024, no, not now. So starting from July 2024, these are slight increase of the fees. For some application are very slight increase, someone is medium increase. So here we have a breakdown of the fees for application fees, immediate route, expedited route, a bridge route, full route, priority review scheme 1, priority review scheme 2. This is in local money. Yeah. And here more fees, again slight change. For administrative change, review change, technical change, change of registrant, and finally annual renewal fee. So to summarize, today we have reviewed the following regulatory updates. In Taiwan, we have reviewed the medical device regulation updates of the main regulation. In Sri Lanka, we have reviewed 2 points, medical device registration license amendment. This was an announcement to the stakeholders here. And in Ecuador, we've seen that the fees for 2024 were not amended. And we have done in-depth analysis for the medical device regulation update. We've seen the new grouping in Malaysia. In China, the announcement of the 12 guidances, the updated and the new guidances. In Hong Kong, we've seen the technical document regarding the artificial intelligence medical device, and the other one regarding software medical device and cybersecurity, and some changes of listed medical devices and what the RRP should be aware of. And finally, in Singapore, we've seen this new or updated list of fee for 2024, presenting a slight increase, but an increase. Yeah, that's all for today. Is there any question? Yeah, Ana Lucia and Gabriela. Okay.
Hi, Iman. Thank you for the presentation. I do have a question about Ecuador. Can you please repeat the second update? Because I didn't get the difference between the previous and the new regulation. In the end, we will still have to submit for a simplified procedure all documents for a regular registration, right?
Yes. Here it's a bit like in both cases, you have to prepare all the documents that are required for a normal presentation, even if it's a simplified procedure. However, what is the difference? Basically, it's a time saving. Instead of presenting everything together and wait for more time, now you just present this 6 document listed here, and then after the approval, only after the approval, you have to send the other list of documents. okay, they have here specified within 30 days from the approval. So you still have to provide all the document, but it's a difference in the procedure, and yeah,
Okay.
and it's still mandatory. Otherwise, it could be cancelled.
Great. Thank you. It's clear now.
You're welcome. Yeah, Gabriela.
Yes. Yes. Hi, Man. Thank you for the presentation.
You're welcome.
I have a question about Taiwan. It's about the how the effect. The effect of the change in the QSD number in existing licenses. You said that if they were approved before the enforcement of the new regulation, that it has no impact. But I wanted to ask about how what's going to happen with renewals and amendments for those licenses. Would they
Sorry?
need to include the yeah? Would they need to include the QSD number?
Yes, yes. They have to include the QSD number.
Mm-hmm. Okay.
Just find the. So in Taiwan, no?
Mm-hmm.
No. Okay. Yes. So they have to include it now. It was not mandatory previously, and the device that were approved before the implementation of this new regulation were, as I said before, were exempt from the QSD number.
Mm-hmm.
And now they all have to include it. However, in cases of renewing prior device approval or submitting a change notification, the KSD become mandatory on all new registration certificates. So,
Okay.
I mean, and this pre-approved or already listed devices, if we have to renew them or made any change, we do have to include UKSD number.
That's
Even
clear.
if they were approved without including the UKSD number.
Okay. Okay, got it. Thank you.
You're welcome. Yeah. Any other question? Yeah, so if there is no more question, thank you for your attendance.
Yeah, thank you so much for coming today, and thank you so much, Aman, for
thank
sharing.
you.
Internal Arazy members can stay on, and if you have any questions, you'll receive a follow-up email soon, so you can ask anything that came up.